Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Good to see you, Doctor. Thanks for being with us.
Hey, Dr. T, great to see you. So we're talking about this 5 to 11-year-old age group. It's been slow to get vaccinated, even here in Massachusetts, which has a high vaccination rate for the overall population. Do those who already have 2 shots need to get that 3rd shot?
It's a great question, Eddie, and I think you hit the nail on the head. Less than 1/3 of kids age 5 to 11 have been fully vaccinated so far. That is by far and away the most important thing we can do, is get them fully vaccinated. After that, I think it's going to make sense that we give a 3rd shot or that booster to this group, especially those that are immunocompromised, where it's already recommended. Additionally, for those that have other chronic medical conditions, but it also may make sense for the general population of 5 to 11 as well. But again, we have to see when the FDA and the CDC sit with this data, what they ultimately conclude.
Yep.
I already know the answer to this, but let's ask and say this to everybody. In the past few months, a lot of people, thousands of people have tested positive for COVID, children included. So what's your advice about getting a shot after an infection? Would you wait a few weeks?
So, Maria, it is very important to get vaccinated after you're infected. We know that that gives you the highest level of defense. But probably you don't want to get vaccinated too early, because if you do, you may not have as good immune boost, and also the side effects from the vaccine, it can be more reactogenic, so you can have more aches, more fevers. So we don't know what the sweet spot is.
Right.
But I'm going to tell you right now what I'm telling my patients, which is basically for most to wait 3 or 4 months.
But that's for the vaccine. That's
right.
Not for the booster, correct?
No, well, it can be for either.
I just want to make that very clear.
If you've been infected, I generally recommend waiting at least 3 to 4 months after, whether you're going to get a primary vaccine series or booster.
So Dr. T, let's talk about COVID itself right now. There is a new COVID variant. It's called Omicron XE that appears to spread even faster than the super contagious BA2. So I think I probably know the answer to this is yes, but is XE here in the Boston area? And I don't mean to be flippant with this question. Should we care?
Right. Well, Eddie, I just got off the phone with we have some great scientists as part of these variant calls that we have each week. And I just spoke to one who said, so far we haven't seen that specifically sequenced. But like you said, there have been a couple of cases in California. The largest number of cases have been in the UK, over 1,000. I still want to be clear, this makes up less than 1% of the variants, even in the United Kingdom.
Yep.
We think this may be 10% more contagious than BA2. Okay, so what is XE? XE is basically a recombination between BA1 Omicron and BA2. What that means, recombination, is a fancy word that means within a person's cells, you get more than one virus that infects the cells and they combine to form a new variant.
Oh my.
So it sounds scary, but so far, these are in small numbers, and I don't think it's going to be a significant problem because I think our background immunity and our antivirals are strong.
Dr. Todd Ellerin, thank you, doctor. Be well.